Hi, I'm Dr. BREN. I'm a depth psychologist. Some people think I'm saying death, but it's depth, D-E-P-T-H. And what that means is the unconscious. And that's really what separates me from most other practitioners in the field of psychology. The field of psychology is mainly about the ego and its functioning, but depth psychology is about the unconscious and how it functions. And since 90% or more of our mind is in the unconscious, depth psychology gets to where our spiritual self is or our soul self is, and that's where I focus my attention. Becoming a depth psychologist was my midlife career transition. The first part of my career, I was a systems analyst, a senior manager for Ernst & Young, doing big system implementations around the Y2K crisis that we went through in the 1990s. I quickly hit the glass ceiling and found that I wasn't really on my soul path. And right after 9/11 happened, I quickly left corporate America and enrolled at Pacifica to get my PhD in depth psychology. And I've been studying depth psychology for over 20 years. And I got into depth psychology because when I was in need myself for psychological services, I found that the clinical approach didn't help me in my depth and my soul and the dark night of the soul that I was going through in my mid-30s. Most people find me because what clinical psychology offers to them doesn't get to the depth of the problem. And they find me after they're going to other therapists and not really getting to the root of the problem. And that's really what depth psychology offers, is root cause issues. And as we know, Western medicine is sort of chasing symptoms, but not really understanding at all systems thinking or root cause. And this is why we have a medical crisis in the world today, and it follows right into the psychological world. The issues that people have when they come to me are similar to what ends them up in the clinical psychologist's office, and that's depression, anxiety, relationship issues, self-esteem issues, emotional issues, probably feeling too much or not feeling enough, or both. And inner child work or trauma from childhood. But the difference is getting to the root cause. And that's what depth psychology is. I mean, because the cause of our issues are in the unconscious, they're not in the conscious mind. So in all seriousness, clinical psychology that doesn't really address the unconscious and its archetypal nature doesn't have the capacity to understand root cause. It can only help with the symptoms, just like Western medicine. So Jungian psychology starts with understanding the shadow and shadow work and pulling back projections, which are the natural way in which the unconscious manifests and shows up in relationships, and most often people are coming in with relationship issues. But the other core piece of Jungian psychology is understanding dreams and dream work and working from there and beginning to understand that the higher self, the self, what we call the self archetype, is sending symbols of healing towards you in your dreams, in your synchronicities, in something that we do in Jungian psychology, active imagination, and that is while you're awake, working with the symbols and characters of your dreams. In addition to the typical Jungian tools like working with dreams and active imagination and symbols of transformation, I work with tools like the Enneagram. I use the Enneagram because it has a component that reflects the personality structure, but also it shows the archetypal connection to the essence of what that personality structure is trying to imitate, falsely, as all of our false selves are doing. And I think that it really demonstrates the essence of what Jungian psychology is about, the complex, which is the personality structure, and the archetype, which is what's in the unconscious. I also use a tool that is often contentious, and I get a lot of negative feedback on my YouTube channel because I say the word astrology. Most people don't know that Jung did astrology on every one of his clients. The natal chart is nothing but a geometrical expression of archetypes. And that gives me the blueprint of one's soul and why and how they came into this world at this time and what soul lessons they have before them. And that's one of the reasons why I use astrology. And of course I use the tool that Jung came up with, which he named psychological types, which is now known as the Myers-Briggs Type Indicator, or MBTI. I use that tool and I try to go in, of course, into the depths of what that tool is really about as well. And it really helps in relationships, understanding how we perceive and judge and interpret things differently. Another tool I use is something called the Gene Keys. Now, what's been popular in the world these days is something called human design, and I haven't been a fan of human design because it doesn't have the characteristics of the archetype and the personality or shadow structure. And that's one of the reasons why I like Richard Rudd's redoing of human design into the Gene Keys. Another thing I use is what Richard Schwartz has made popular, the Internal Family Systems, or IFS. I call it Jungian parts work because it naturally comes out of Jung's work on complexes and archetypes. And so that's a big part of the work that I do, specifically for childhood trauma. Thank you for watching this, and please be sure to reach out if you have any more questions. Namaste.